And soon we'll be crossing to the UK, where there's been mass protests against draconian lockdowns. By the way, the UK media is saying that crowd was just a few hundred. Can you believe that? Much of the media appears as invested in the lockdown strategy as the UK government, which has locked down harder and longer than just about anywhere else in the world. And yet it has among the world's worst per capita death rates for COVID. In fact, the UK's death rate is worse than the US, worse than most of Europe, and significantly worse than Sweden, which never locked down, not even once. Some of the best performing countries in the world, including Japan, South Korea, Taiwan, never implemented anything like the lockdowns we've seen in the UK or parts of the US like New York and California. Even the World Health Organization has made it clear that lockdowns should be the very, very last resort, and that a proportional and targeted response is the way forward. But for many governments around the world, the response to COVID has been to lock up the healthy population to prevent the elderly and infirm from being infected. 2 weeks to flatten the curve has turned into 12 months of harsh restrictions. That strategy not only has caused devastating consequences in the West, but in the poorest parts of the world, it is causing hundreds of thousands of additional deaths. The UN estimates that there will have been 228,000 additional deaths of children under 5 years of age in just 6 Asian countries due to COVID strategies employed by governments. That's not additional deaths of people aged over 85 with a number of pre-existing conditions, but children under 5 years of age, dying because crucial services, including immunisation programs, have been disrupted by lockdowns and their government's COVID response. You wouldn't be blamed for asking, is the cure worse than the disease? The UN report into the direct and indirect effects of COVID-19 pandemic and response in South Asia also found that COVID lockdowns and disruptions of essential services had a devastating effect on maternal deaths and caused thousands of additional deaths in adolescents who couldn't get vital treatments for HIV, for malaria and TB. Those horrific figures are repeated across Africa and Latin America. Last year, we were warned that lockdowns were disrupting around 80% of TB, HIV and malaria programs worldwide, with catastrophic consequences. The young and the poor are paying a very heavy price during this pandemic. It's little wonder that Dr. Jay Bhattacharya, the renowned Stanford University Medical School professor, epidemiologist and public health policy expert, has called COVID lockdowns the single worst public health mistake in over a century. We have locked up the young and the healthy, recklessly destroyed lives and livelihoods, and stripped people of their hard-fought-for liberties to tackle a virus that disproportionately impacts the very sick and the very old. Instead of protecting those most vulnerable to dying or being hospitalised with COVID, we have locked down entire populations, the overwhelming majority of whom wouldn't even know they had COVID, because most of those infected have no symptoms or very mild symptoms. Indeed, in the UK, a study found that 86% of people who tested positive to COVID-19 were asymptomatic, no symptoms. But Boris Johnson, who campaigned as a Conservative and won in a landslide, has governed like a hopelessly inept greenie and inflicted multiple lockdowns on the UK. One can only hope that in the UK and around the world, the vaccine rollout will end this lockdown madness and restore people's freedoms. In the years to come, we will learn the full cost of this pandemic, not just the lives lost to COVID, but the lives lost to the COVID response, particularly the lives of young people in the poorest countries.